Greetings, and thank you once again for spending a few minutes with us here at FHN to hear about what's going on with our latest COVID-19 update. This week, I'm pleased to be joined by Dr. Erich Awender, who is the director of our emergency medicine program. And Dr. Awender has some very unique perspectives on COVID-19 from a personal standpoint as well as from the patients that he cares for each and every day. So I want to thank Dr. Awender for spending his time and sharing his expertise and advice with our community. Thank you.
It was actually quite a while. We know that the first case of COVID in Illinois showed up in January, and then the lockdown occurred in March. And so I developed my symptoms at the end of October. So I had probably been seeing COVID positive patients for a good 7 or 8 months before I became infected. It's a lot. Probably since the onset of the pandemic here, at least 1 or 2 patients a shift. And during our busiest times, especially recently over the last couple of months, there were probably shifts where I was seeing 5 or 6 or more per day. I really don't. Since the beginning, we had worn our N95 masks for every patient encounter that we thought could possibly be a COVID. And then more recently, we wore them for every patient in the department. Probably for the last 6 months, we've done that. And then we would ramp that up if there were patients that were either known COVID positive or suspected. So we were wearing gloves and face shields and sometimes even the respirators, along with what we always do is hand washing in between and having the patients masked. So it's really hard to say. We would even wear our masks in the common areas and in the workstations and pretty much wore them during the entire shift. So during the time where I contracted it, it was definitely, if you want to call it a surge, we weren't overwhelmed, but there was definitely a significant uptick in cases. So my best guess is that it was at work, but you can pick it up anywhere. I did have a child at home who had COVID a couple of weeks before I did. And then out in the community, there's a lot of people that are walking around who may be asymptomatic or pre-symptomatic or at the tail end and still shedding. So it's really difficult to say. It was the alteration in my sense of taste and smell. That's when I pretty much figured I've got it, because 3 of my children had the same thing and also all tested positive. So that was about the 3rd or 4th day of symptoms, and I tested positive the day after. I noticed that things just were tasting off. It was about 3 weeks before I was able to go back and start working again. I think the only thing is my sense of taste is still not completely normal. I still notice that there's a difference, especially with like carbonated beverages or spicy foods. And my energy level is still not back to normal. I do notice that I tire more easily than usual. Well, obviously we tried to socially distance as much as possible. And during the worst part of my illness, after the first 3 or 4 days where I thought I just had a mild cold, just had some stuffy nose, I pretty much sequestered myself downstairs and stayed on the couch. And during the time where I had a bad cough and spiked daily fevers, I was pretty much on my own, and the others were upstairs, I was downstairs, and it must have worked because my wife in the same household didn't get it. She tested negative for the antigen and then later negative for the antibody. Yeah, there is a pattern. I mean, we know for sure young people do much better. Kids generally do great with this, and it tends to have a predilection for older people and people with underlying medical problems. But there are exceptions. I have taken care of folks in their 80s and 90s who did very well with this and actually were discharged home. And I've taken care of folks in their 20s and 30s who were very ill, and we actually had to admit them to the hospital for a few days because they had, lung inflammation, were having difficulty breathing, low oxygen levels, dehydration. So you never really know. I would say that we shouldn't get complacent. Illinois has done well, especially compared, I think, to the rest of the Midwest over the past couple of months. Our cases have plateaued, and over the last month or so, we're heading downward in the right direction. But there's always the risk that you're going to have a surge if you let your guard down and think, hey, we're out of the woods. We're not quite yet. Yes, we have the vaccination starting right now. That's just for frontline healthcare workers. It's going to be several months until we get these vaccinations to the at-risk groups in the community who need it, and until we hit a kind of a critical mass where we have the herd immunity. So even though we're heading in the right direction and we're looking forward to hopefully normal times in the summer, we don't want to, let our guard down now and, risk a backslide, especially with the holidays. A lot of people were probably traveling, and there's always the risk that they may have contracted something elsewhere, and then they bring it back and they'll spread it throughout the community. And that could be a 2 to 3 week delay. So I think if in the next week or two we don't see another spike, we're hopefully out of the woods as far as the holiday surge is concerned, but we still need to practice our social distancing, our masking if that's not possible, and then just common sense things that you really should do all the time. Respiratory etiquette, coughing and sneezing into your elbow or into a handkerchief and throw that away. Good hand hygiene, disinfecting high-touch surfaces, that kind of thing. And also staying home if you're sick.
In the past couple of weeks, we really haven't seen much of a change in the actual number of cases or unique hospitalizations, which is a good thing. So we've been able to hold a level or steady pace. One of the things that is really exciting is that we've started to be able to provide vaccinations for some of our team members. And so that's a great start to making sure that we're winning this battle. It's an interesting, I wouldn't say phenomenon, but it's an interesting fact that we have not seen a good deal of flu cases like we normally do at this time of year. In fact, we've only had one validated flu case this flu season, and that person was also positive with COVID-19. They were also a younger person, but we've had no other documented cases where we've had a test come back positive for the influenza virus. And that also includes RSV, and we're even seeing a lower incidence of the common cold during this time. So certainly that the measures are being taken to control COVID-19 are impacting or limiting the spread of influenza or other respiratory viruses as well. As I previously mentioned, is at present we have not seen a surge on top of a surge or even much of an uptake post-holidays. And I'm grateful because that means that people were celebrating with their loved ones very carefully and very safely because we're not seeing that uptick. So hopefully we'll be able to maintain that for the remainder of the season until we really get COVID-19 well under control. FHN for the past couple of weeks has been running an average daily census, which is total number of beds that are filled, around 60. And as you're aware, we are licensed for 100 beds, so we certainly have capacity there. Also, we have great capacity on our ventilators as well. We've been running at less than 50% most of the time. However, we have been averaging about 10 positive COVID inpatients, as well as having some of those patients, 1 to 2, on a ventilator at any given point in time. So it's certainly still here, but it's been well within our ability to manage. The greatest concern with our surge isn't always about the number of beds that we have or the number of ventilators, but it's really the stress that it puts on the staff and the strain that it puts on our workforce, because it's much more labor intensive to be able to take care of a lot of COVID-19 patients. That's much more demanding on our workers, and so workforce is probably the greatest concern that we have, as always, moving through this continuing pandemic. Currently, we're doing well with the staff that we have. They are working incredibly hard, and many of them are working long hours to keep our community well and to help those that are truly in need. So they're doing a fantastic job and able to manage well at our current rates and our current capacity. We certainly could see a few more and be able to care for those individuals without overly stressing our staff. However, if we did see a widespread surge and a great uptick in activity, that would be a difficult strain on all of our caregivers. The staff are very excited about being able to take the vaccinations, and we have a blend of both staff that have received Pfizer doses as well as staff that have received Moderna doses. We've completed a first round of Pfizer doses and also a second round of Pfizer doses. So we have a number of our staff that have completed the vaccination regime, and if effective, should be 95% protected against COVID-19, which is a great reassurance for those staff members. We have immunized a great deal, several hundred of other staff members with their first doses of Moderna, and they'll be receiving their second doses within the upcoming week or two here. We will continue to offer vaccinations to our staff so long as we can procure the vaccine, but our goal is to have any staff member who is willing to become vaccinated, and we're prioritizing our frontline caregivers, those that are interacting with patients directly first, to be vaccinated before the end of January. For the public, individuals such as police officers, law enforcement, emergency medical services like firefighters have received some vaccinations. Other healthcare workers have been provided the opportunity, dentists, chiropractors, those directly involved with the care of individuals have had the opportunity to receive vaccinations through our local health departments. There's a fairly intensive plan. There are different phases through different areas. The states all vary a little bit, but for the state of Illinois, we are following the plan from the Illinois Department of Public Health. Phase 1A is the group that we are currently completing, which is those healthcare workers, those hospital workers, those EMS, law enforcement individuals, long-term care facilities, so the residents and workers at those long-term care facilities are part of Phase 1A. and we are getting ready to begin Phase 1B. And Phase 1B will include a much bigger group. Phase 1B goes to those group homes or those congregate living areas. Also, school systems such as educators will be provided the vaccine. We'll have agricultural workers, manufacturers, as well as different delivery drivers, the postal workers, so United States Postal Service would be people that would be eligible to receive the vaccine. Anybody that really has a high amount of contact or interactions with people as essential workers on a regular basis. In addition, we will be starting to vaccinate individuals that are 65 years of age or older during that Phase 1B as well. So more information is forthcoming on that. Again, the Illinois Department of Public Health is leading that process, and we are working closely with our local health departments on what those next steps will be. After that group, there is a Phase 1C, which really opens up to a much wider audience, and shortly thereafter, it will be available to the general public. Generally, depending on the supply of vaccine, will be how fast can we get that rolled out, when do we start to move from those Phase 1B to 1C, and so on, is not certain at this point, but that's the plan, and the age groups that will be immunized will be defined in those further phases or steps. To continue your due diligence and doing the great work that you are doing, don't put off your healthcare needs. We're safe, we're available, we're here for you to make sure that we are able to provide care safely for you or your loved ones. But also be patient. We're looking at the horizon, and this pandemic does have an end in sight. We're getting closer. We're making great strides. We just need to keep up our due diligence and be smart about the things that we're doing as we move over the next several months, so that hopefully this summer will be a much different looking summer than what we've seen this past year.